Dr. Eric Fishman with EHR-TV, and we're in Las Vegas, Nevada at HIMSS 2012. And I have the pleasure of speaking with Matt Hawkins, CEO of Vitera Healthcare Solutions. And Matt, thank you for taking the time with me today.
Good morning, thank you.
I appreciate it. You're taking over quite a large company with obviously a portfolio of products. It's got a legacy from decades ago of tens of thousands of medical manager users. I was a proud medical manager user in my own practice for many years.
Yes.
Tell me, and we'll get to some of the nuts and bolts, but tell me your vision of where you're taking the company over the next couple of years.
We're thrilled to be in the business. The company has a rich, as you mentioned, a rich legacy of customer practices that use us, more than 11,000 practices and 80,000 physicians. So everything we do will be focused on, first and foremost, giving that installed base of customers new technology, exciting technology, helping them migrate to that technology if they desire to, or give them a stable path where they can stay on that practice management or that electronic health record technology today and continue to practice great healthcare.
And you've mentioned 11,000 practices. Are the majority of those on the practice management system, or a very substantial number of those doing clinical documentation, the electronic health record, e-prescribing?
Majority are on practice management today. Increasingly, they're also choosing to select our electronic health record product.
And I understand you have a cloud-based product coming out in the very near future.
We do.
And so tell me about the Vitera InterG cloud-based product.
Yes, so we have several major practice management products, as you mentioned, Medical Manager being one, Medware, Health Pro going back much further, and then we also have a product called InterG.
Right.
And InterG offers practice management as well as electronic health record, so you can buy that in a full suite. In addition to that full suite, very rich technology in the InterG suite, we're offering soon to come to market in the springtime a cloud-based solution called Vitera InterG Cloud.
Okay.
It's a multi-tenant cloud offering that will primarily target toward the small, 1 to 3 to 4 doctor practice. We think that it will help them achieve utilizing great technology while at the same time being able to reduce some of the hassle of having hardware and wires and all sorts of routers and servers in their own practice.
And I've certainly said many times that the smaller practices should be only in the cloud because they don't need that problems of a client server.
Grateful for that support, yeah.
So tell me about your functionality that will be there, the e-prescribing, obviously the billing systems, clinical decision support, and things of that nature.
Yes, of course. So the InterG Cloud product will have full practice management capability, full clinical and decision support capability. It will be a full EHR, and deployed in a cloud mode. We'll also, in fact, it just achieved meaningful use certification last week.
Well, congratulations.
Thank you. And we're well on our way to SureScript certification as well. So e-prescribing will be a major part of what we offer. And then, certainly the claims interface and the billing functionality, the claims reimbursement, and the ability to track a claim from start to finish will be a part of that cloud offering as well.
Talk about documentation, if you will, for a moment. I think you know that I'm particularly interested in speech recognition and
Yes.
how the physician gets the information into the chart. Tell me Vitera's position in that.
Well, clinical documentation is very important. We do partner with an entity today to provide clinical documentation services and dictation services with language support. We're always looking to make it easier for our practitioners and more efficient for them to know what the procedures that they've provided or what they've done in a particular patient engagement or patient scenario. So if there's some language support mechanism that's out there that would be more effective or better for a client practice to use, we would definitely want to look at that and evaluate that and offer that to them.
And thank you. Tell me what you see as Vitera's strengths. And there's 1,100 booths here at HIMSS, and
yes.
You've got 80,000 people using your technology. There's obviously a reason for that. What are some of the things that you do better than your competitors?
Well, I believe it starts with our people. We have a wonderful group of people, and many of whom have been in the industry for a number of years. We have great technology that team of people have developed. And we also have a great group of clients. So I think our position in the market is such that we can serve and provide great service, great support, and great technology to that group of clients. And we're focused on the ambulatory side of the market. We're not from the hospital down to the physician practice. We're actually at the office. We're trying to understand the workflows. We're working with them, with practitioners, to make sure that the way our software works is easy for them and really fits the practice need. So we want to always stay true to the office-based practitioner.
So Matt, tell me about the mobility aspects of care is undertaken by Vitera physicians. Obviously, physicians are not chained to an office. They're out and about, and everyone has an iPhone, an iPad, other mobile devices. And how do they utilize your software with that?
They do, and they expect access anytime, anywhere. And one of the things we're working on within our product roadmap that we expect to launch later this year is a native solution for the iPad.
Okay.
Soon to follow would be the Android and some other mobile devices, where doctors can practice medicine using our technology, the Entergy product that's mobile enabled, and they'll be able to provide great healthcare that way. And we're not going to provide every service. It'll be tailored primarily to the real features and functionalities that the practitioner needs. So dictation and the ability, to dictate while they're making rounds, the ability to transcribe and do some things that they need to do in a mobile setting, I think will be the things that we'll focus on.
And we've been speaking about physicians, but all of this is for the patient. And so tell me about the patient engagement.
That's a great question. Increasingly, patients like us, we're all patients as well as consumers of information. We expect access to information. We expect an elegant experience as we engage with the doctors that we visit. We want to be able to schedule appointments. We want to be able to pay bills online. We'd like to be able to manage our health care in a web-based environment as well as in person. So a lot of the work that we're doing is ensuring that our technology has a very elegant way for a practice to engage with the patient and vice versa, whether it's a portal solution, whether it's a mobile device solution, that a patient wants to schedule an appointment or get reminded about an appointment or pay a bill or review some content about a particular treatment that they might be receiving or a particular prescription that they've been prescribed. We want to be able to ensure that our technology allows for that, and so we've got several things in the works there as well.
Very good, Matt, thank you. When I hear about patient portals, I think about interoperability, interconnectivity.
Yes.
It's a buzzword, it's maybe overused, but it's a critically important issue. And how's Vitera addressing that?
So a major theme of within our product vision is connectivity and ease of use. And we don't pretend to know everything that a practice may want to connect with. That being said, we want to make sure our technology is interoperable and connects very effectively and efficiently with any number of other technologies. And a lot of trends are emerging right now. HIE seems to be very important, and we'll talk more about accountable care in the months and years ahead, and making sure that practices have solutions that enable them to connect to provide an accountable care episode for a patient, and also be able to have a great opportunity to exchange data in a HIPAA compliant manner will be things that we'll be focused on.
Critical issue. Let's close on the future. We've got 5010, and so tell me about that.
5010, well, Vitera Healthcare Solutions as a business is very focused on making sure our client practices have their claims operate in a 5010 compliant manner.
Were you happy to see ICD-10 delayed a little bit?
I think ICD-10 will be good for the industry, more comprehensive set of codes to make sure that there's consistency of care is good for the industry. That being said, I think the delay is helpful. It allows practices more time, and we have task forces at Vitera that are focused on helping our clients be able to upgrade to a 5010 compliant or even an ICD-10 enabled solution. And we're very excited about where we're headed in the industry that way. We work to support all of our clients.
Matt, I want to say thank you very much.
Thank you.
I appreciate your time.
Appreciate it.
This is Dr. Eric Fishman. We've been speaking with Matt Hawkins, CEO of Vitera Healthcare Solutions. Thank you.